Thank you for being here. By the way, let me just thank many in the audience who have sent a letter in support of the bill that Murphy and I have put up. And I thank you all for your concern and for being here. I'm going to ask you questions. I only have 5 minutes, now 4 minutes and 45 seconds. And so please keep your answers brief. And if I interrupt, it's not to be rude or peremptory. It is just because I got a limited time. Ms. Enomoto, GAO has released 2 reports this year critical of how HHS has managed mental health issues and singling out SAMHSA for some of that. So my first questions will center upon that. HHS is charged with leading the federal government's public health efforts related to mental health and substance abuse, and SAMHSA is specifically told to promote coordination of programs related to mental illness through the federal government. The Federal Executive Steering Committee for Mental Health, with members across the federal government, is designated to work on these issues, but GAO reports that you have not met since 2009. HHS officials have stated that the Behavioral Health Coordinating Council, the BHCC, performs some functions previously carried out by the steering committee, yet that is limited to HHS and is not interagency. While that sort of coordination is important, it doesn't take the place of or achieve the level of leadership GAO has previously found key to successful coordination and that which is essential to identifying whether there's gaps in services. By the way, I'll also point out that the Cassidy-Murphy bill creates an assistant secretary for mental health specifically charged to do this job, the interagency coordination, which has not been done since 2009. That being the case, would you agree that HHS should raise what are your thoughts about the Cassidy-Murphy bill? Do you think HHS should raise that profile to get that interagency coordination, which despite being mandated has not occurred since 2009? Thoughts?
I think any effort to raise the profile of mental health issues and to increase collaboration across federal government is a good one. I'm happy to engage in further conversation and work with you on creating a positive opportunity for that collaboration. You noted that the FESC, the Federal Executive Steering Committee, hasn't met since 2009. The BHCC started meeting in 2010, but many subcomponents of the original Federal Executive Steering Committee, which had 25 components participating, do still meet. So the Federal Executive Steering Committee on Trauma, on Disaster, there are also groups related to employment that have
really want to hear about mental health. And that's what appears to be what was lacking per GAO. Let me move on again, just limited time. The second report talked about the problems of a lack of evaluation for programs for the seriously mental ill at SAMHSA. For example, of 30 programs specifically targeting individuals with SMI, 9 had a completed program evaluation, 4 had evaluation underway, 17 had no evaluation completed, and none planned. I can go through, but it's more like that. Dismal statistics regarding those getting evaluated. And again, I'll say that the Cassidy-Murphy bill focuses on the need for evidence-based practices. That said, recognizing that there are serious gaps and that there's need for consistency in reviewing and monitoring programs, what is SAMHSA doing to create a better culture of evaluation at the agency?
I agree that evaluation is a really important issue. SAMHSA takes its responsibility regarding program oversight very seriously. We're continually working to improve our—
Can you give me a specific, because I got limited time?
SAMHSA has established a SAMHSA evaluation committee, so we are overlooking all of our programs to identify what is the right level of evaluation.
The 17 which were not evaluated, none were planned. How do we avoid that? Why did that ever occur?
I think there was some challenges in terms of how those were measured. So I don't know that that's exactly the same way that we see it. However, we are committed to evaluating our programs and will continue to do so.
Now, Dr. Insel, again, thank you for your service. You've mentioned you've written before that, I'm going to go to NIH funding right now, research funding. I've been told that the reason more money has not been put towards mental health is that the scientific promise is not there as it might be elsewhere. You've previously noted in written documents that you've published that if you look at DALYs, Disability Life Years Adjusted, the amount that SMI gets is below that which would normally be the mean. Others, like AIDS, is way up here, but serious mental illness is there. I've also seen a statistic that we spend at NIH $987 for every death from suicide, and $420,000 for every death from HIV. 420,987. But it may be too difficult. Is it worthwhile to put more dollars specifically towards the issue of suicide, knowing it's so heterogeneous? And if we put more research dollars there, can we expect to see some benefit from that? Is there academic promise?
It's a good point and a good question. How do you balance both scientific traction and the burden of disease? And we look at both of those in making decisions about investments. I think we have the traction here. I think it is a place where greater investment will get us greater return. I think we see that already when we got the Recovery Act dollars in as additional money. The results of that are spectacular. We have lots of projects that would not have happened that we can point to from Recovery Act dollars, which I think are some of the best things that this institute has done over the last decade. So no question that we could use more funding in great ways. That last issue here, just take a moment. In comparing suicide to AIDS, I want to stress the fact that that investment in AIDS could be attributed to the fact that we've reduced mortality 50%.
Totally accept that.
So it may be that we're not spending too much on AIDS, but we're not spending enough on other areas like
We'll
suicide
talk to the
prevention.
appropriators and try and get you all more.
Thank you very much.
I've gone over. I yield back. Thank you.
Thank you, Senator Cassidy. Senator Murphy.
Thank you very much,